Welcome to This Just In, the show bringing you the latest advancements in healthcare, strategy, innovation, and public policy. And now, for the fastest voice in healthcare, here's your host, Justin Barnes.
Thank you for tuning in, and welcome to This Just In. I'm your host, Justin Barnes. In these segments, I'll bring you the latest advancements in healthcare, strategy, innovation, and public policy. As always, we're broadcasting from the This Just In studios on the Business Radio X network, as well as the Healthcare Now radio network. For this episode, my 210th episode, we have a very special guest, an industry pioneer returning to the show, Dr. Sylvan Waller. Welcome back to the show, Dr. Waller.
Thank you very much, Justin. I appreciate it.
I'm in my 5 years of broadcasting this show, I believe now you have been on more than anybody else between the individual shows like this, but also the special broadcasts that we do at the annual HIMSS conference and even here in Atlanta from the studio. You've been my most frequent guest, so I appreciate that, my friend.
Well, I appreciate continuing to get asked back. I think I always think the content, the topics, and certainly the other speakers that I get to learn from over time have been tremendous. So I always appreciate the opportunity to continue the conversation.
Yeah, thank you, my friend. And yeah, you have literally some of the best thought leadership and always most timely to where healthcare is evolving, how and where it's evolving. And you've also been a part of, and I want to say thank you because you've also been a part of my health innovation think tank that we started back in 2017, actually. And we just had our 7th think tank, which you participated in. So again, grateful for all your support through the years, my friend.
And I think the think tank has been fantastic. I mean, you talk about collaboration, and we need it more now than ever in healthcare, especially with all the changes and sort of the pace of change. So it's been really good to pull people from a number of different industries and sort of verticals within healthcare. But I think that collaboration is really critical, especially at the moment.
Yeah, I completely agree. And you know, we've even seen that. I think even the show that we just did, that latest think tank, it was condensed because of COVID, but the speakers that we had and the collaboration amongst certainly the panel and the guests showed the kind of the angst that we have out there and that we want to share. We have best practices, certainly now with telehealth and with COVID, you know, what we've learned through COVID. There's so much that we actually want to share as thought leaders, people who are actually on the front lines. And I clearly saw that from that individual session. So, and I'm sure you did as well, but, you know, very exciting times, but also very exciting because I'm happy to announce to my listenership and everybody that takes the time to listen to the show each week that Dr. Waller will actually be a guest host in the coming weeks and months. We're going to announce much more of that, and as we put the show together. But Sylvan and I have been working on this for a while now, and I think this is a great time, and even more, like I just said, with how healthcare is evolving, digital health, virtual care, telehealth. You know, you're a pioneer in telehealth. You're a pioneer in virtual care. So where that is now even more important than ever before, I think even accelerated, you know, some say 5 years, it's extremely timely for you to join the show in a more official capacity. So very excited for that. What are your thoughts there, Dr. Waller?
Thank you, Justin. I really appreciate it. And I think, we have been collaborating for a while. And I think back to our days at the Advanced Technology Development Center, working as EIRs there, and certainly, you know, working and mentoring a lot of the early stage digital health companies and trying to bring our healthcare experience to those technologists, and to those early stage companies. And I think since then, we've continued to collaborate in terms of both the think tank and obviously being able to participate on your radio show. So I'm very excited about continuing to work with you to find thought leaders and to be able to share this information with the people who want it, need it, and are going to help us, you know, continue to bring healthcare to the next level. And I think the last, 6-8 months continues to show we have a lot of work to do. But I think there's more excitement now because the pace of change is so high, and that's where we can provide value to, our collective listeners.
I completely agree. I'm really excited for you to join the show. You have, again, such great experience being a CEO, a founder in telehealth, and in actually working with one of the largest. You're with MD Live, correct? I mean, one of the largest telehealth providers out there, direct to consumer. Is that correct?
Yeah, I worked with MD Live as their chief medical officer, and we worked both with payers, self-insured employers, and then directly with health systems as well. And we did a little bit on the direct-to-consumer side, but mostly it was really on the enterprise side. And I think, we'll get into that in a little more detail later, but I think that was, the sort of 1.0 version of telehealth was, people started there because there was a clear market. And now what we see is there's so much demand, there's so much interest in telehealth that it's expanded, well beyond sort of that 1.0 version.
Yeah, completely agree. So yeah, I think there's just so many facets that you're going to bring to the show and your deep experience and expertise. So with that, let's dive in a little, because this show is really, we're continuing on our kind of our show themes that we've had recently around digital health strategy, certainly virtual care, telemedicine, telehealth, remote patient monitoring, remote care management, all weaves in to a lot of the themes that we've been covering in the most recent months, even at this point. So it's really exciting. But let's do a level set of where we are as an industry with regards to telehealth and virtual care and remote care management and healthcare in general. So, I'd love it. Let's take a step back. What are you seeing out there, Dr. Waller?
Yeah. So I get a lot of questions from both startups, physicians, health systems, and certainly payers as well, wanting to know, what is the new normal? How do we adapt to the landscape that we're in today? And obviously that landscape is COVID, and it's forced a lot of changes that everybody said, this will take another 5 years to get to where we are today. But COVID has certainly forced those changes really rapidly. And I think the companies, the provider groups, the health systems, hospitals, payers who are being successful are the ones who can really pivot pretty rapidly. And you and I have talked about sort of, the Wayne Gretzky, don't skate to where the puck is right now, but really anticipate where it's going to be in the future. And that's where a lot of your efforts should be directed. And so when you talk about, strategy in digital health, I think it's more important than ever. And it's not building on, what does the environment look like right now? But the winners are really going to be the folks who are trying to anticipate what do things look like 3 to 5 years from now, and how do we build infrastructure and strategies around that?
Yeah, I love it. So I know bring this up pretty quickly in the discussion, but winners and losers, like what are you seeing out there from progress, and where do you see as, oh gosh, these things are happening and it's not good, we've got to change it, or we got to tell this segment that you got to change some stuff because you're going to fall behind? Like, any winners and losers out there, and a positive side, not in a bad way?
Yeah, absolutely. I think the organizations that we've seen, you and I both, the ones that are nimble and can react to what's going on right now, right? A lot of the health systems, across the US have had massive losses in the last couple of months because they had, essentially the whole outpatient business was shut down. Yeah. So those organizations that can pivot pretty quickly and say, what else can we do so that this business isn't totally lost to us? I think those folks have been, bigger winners. And some of the data is, pretty incredible. When you look at like NYU, one of their hospitals went from, doing 0 telehealth visits to 5,500 in a 2-week period. That's a massive change for an organization. But being nimble, understanding that, this likely will be a significant part of how healthcare is delivered going forward. So let's think about how we can put in place both the technology, the systems process, the workforce to be able to do that. And it's an investment, right? These things don't, typically they don't happen overnight. There's always the sort of success story like NYU, but a lot of hospitals, and I think we had a good case study from another health system recently that talked about the change management, the technology, the workflow, the physician adoption and patient adoption. They take time, and COVID's been a huge forcing function, but I still think we've got a lot of room to go there.
Yeah, I completely agree. It's March, April, May was for me was a fun time. I'm knee deep in virtual care, telehealth, remote patient monitoring, all that good stuff. And one of my companies, we brought, 5,500 providers live, I think over 70 practices and health systems in that time period. And so I actually got to get kind of back in the thick of it, in the throes of, implementation and building a company and trying to keep everything flowing and hiring and just, really guiding that growth in the right way. And then also trying to get out there and help organizations make the right decisions from a standpoint of, and that's the kind of side where I type on there's some certainly great winners. FQHCs are doing really well, and it's one of the areas that I focused a lot on. But also there's practices though, and I bring this up in a lot of my shows. That's there's a study out there that say, hey, up to 1/3 of the smaller practices aren't buying technology this year for various reasons, and I totally respect and understand why. They're stressed, they're strained on their business, they're strained probably on cash flow. I get all that, and that's completely understandable. However, I can't even imagine trying to navigate, and even if we go into another dip of the coronavirus and COVID-19, trying to operate your business without having a digital front door, without having a virtual care platform, without being able to offer telehealth, because your patients are going somewhere. Yep. And you just don't want to lose them in the long run. You may have already lost them. You might lost some, but you maybe get some of those back. So that's when I bring up the kind of the loser side. I'm like, you've got to figure this out. You've got to look for a product that works for you, or a platform, that works for you and can help you achieve your goals. And you've got to have goals in this area, because if you don't, like I'm a military guy, you'll get outflanked. And that's the part where I'm concerned.
Yeah, I totally agree. I mean, I think the winners are the ones who are adapting quickly. Yeah. The winners are also ones who have invested in the technology, the workflow, but the workforce as well, right? That's a critical aspect, because just having the technology doesn't mean that you can deliver care a lot, better, faster, cheaper. You have to have an engaged workforce as well. And I think the health systems and really a lot of the smaller companies as well that have really focused on creating the system, process, infrastructure, not going overboard, but just making sure that they're prepared, or were as prepared as they could be for the events that have unfolded over the last 6 to 8 months. And those are the folks that are winning. And you're absolutely right. I mean, I think even from a number of years ago, there were CMS published for a lot of the health systems that were in the bottom third of the quality rankings, right? Those are the ones who are really financially challenged. And it's really hard for them to catch up because they don't have the resources. And that's been a big issue within even CMS reimbursement, right? To say, if you're a health system and you're continuing to lose money on an annual basis, it's hard to want to reinvest that in technology, but then you just fall further and further behind. And I think it goes with, the digital health companies as well, the ones that, are able to really focus on investing in the product are the ones who are now gaining market share and are getting adoption, and they're the winners in this space. And the ones who, aren't investing in their product and services, that are, staying static or have an existing business model and haven't figured out how to pivot that, those are the folks who we're now starting to see are the losers in this COVID pandemic.
Yeah. So picking up on that talk track, what are you seeing in terms of virtual care trends? I mean, are we in virtual care 2.0? Certainly, I feel we're in telehealth 2.0, but what are some of your thoughts there, Dr. Silver?
Yeah, and I think it's progressed a little bit further than that. So, 1.0 of sort of digital health was using technology, but it was used in a way to really recreate the brick and mortar experience. We used video and voice to essentially say, instead of coming into a doctor's office, we're going to have you, even if it's through an app, we're going to have you, create your patient profile, sign up for a time slot with the doctor. But the technology didn't really change how we interacted. It certainly made it more accessible for patients, which is great and I think incredibly important. And then the next iteration was really looking at how do we expand the capability of telehealth. And that's where remote patient monitoring came in. That's where a lot of the other additional sort of digital health services came in. And I think now we're at a point where we're starting to see 3.0 in terms of digital health. And that means using technology in a way that it's not just recreating the brick and mortar experience, but it's much more integrated into the experience altogether. And we can talk a little bit about what some of those things look like. But I think data is a huge part of that, and that's where we're starting to see telehealth and digital health 3.0 versus where we were even 5 years ago.
That's excellent. I agree. So, what are some of the barriers for provider organizations to move down this path? And I know there's a lot, but can you kind of give like a glide path or things to maybe encourage people that, how to engage, where to engage, maybe what to look for and how to get past it?
Yeah, I mean, the biggest barriers were people, it would still, telehealth and digital health in particular were still sort of a black box for providers. So they knew it was something that they wanted to do. They felt like they needed to do it, but they weren't exactly sure how to take those first steps, and they didn't know how their care teams would respond, and they didn't know how patients would respond. And I think we've seen a tremendous de-risking over the last 6 to 8 months around how providers, physicians in particular, have responded. I mean, they've really taken to it. And I work with, even a number of specialists, neurologists, gastroenterologists, and at the beginning of this, they said, "Hey, we need telehealth, but we've tried it before and it doesn't really work." And so you have to guide somebody through the process to say, when we talk about digital health or telehealth in particular, what does that mean for you?
Right.
What does that mean for your patient? And how does it get integrated into your practice? Because if you're just trying to drop a standalone module into your existing health IT infrastructure, it's not going to be successful. And that's where I've seen a lot of times people declare it a failure because it requires work, just like anything else.
Yeah, I think you and I brought up a couple of times during the think tank. That was one of the early best practices that came out from specifically regarding telehealth or even telemedicine. Is you've got to integrate it into the care strategy overall. In most use cases, it does not work in a standalone environment. Certainly, there could be some, but for the majority of healthcare and health system in general, is you've got to integrate it into the care strategy. You've got to, and also start off small. People have, this when Gusto and they heard the sales pitches. Oh yeah, we can do telehealth and for your entire healthcare organization. Well, we said no. Actually, let's pick a segment, a specific condition, or a set of maybe 500 patients or 1,000 patients or a specific use case just to get started. Socialize the concept. This is a lot of change management that has to happen within your organization, and so I think it's one of the best practices. We obviously started off with a couple of years ago.
Yeah, I agree. And I think, certainly in my background on the consulting side, change management is always an incredibly important component of it, right? It's not just the technology. Yeah. The workflow is critical. The workforce is critical, but then you have to bring everybody along with you and you have to provide context. And if people, especially the physicians, don't have context and know why we're trying to do this, it's a significant barrier to adoption. So I think, from the provider group in terms of, being able to break down those barriers, we have seen much more adoption. And instead of trying to push, the proverbial rock uphill, now a lot of the physicians and other provider organizations are coming to folks like us to say, help us with our digital health strategy, help us with our telehealth strategy. We know we need to have this. We don't exactly know how to do it. And we need folks who understand how to navigate through these different barriers and make it, worthwhile and compelling for not only our care teams, but our patients as well.
Yeah, I completely agree. And so let's dive into an important component because we just touched on it with change management because it's a critical success factor or a key success factor in any technology implementation, certainly when we get as complex and mission critical as virtual care and certainly even those EHR deployments. But what are you seeing in the terms of evolving technology? Like, what are you excited about out there? What kind of platforms or what should care providers and organizations look for regarding technology in this new era?
Yeah, I think it's really looking at what are the 3.0 versions of telehealth, and how do we make sure that and digital health in particular, how do we make sure that effectively the technology is relatively lightweight? That means you can apply it in a very nimble fashion. It doesn't necessarily have to touch every patient in your organization. And I know oftentimes we talk about, we want interoperability. We want to make sure that there's, free flow of data back and forth. Yeah. But as you said, that's not necessarily a starting place. That's a end goal that you may articulate. But in order to be successful, like a lot of the health systems that went from, NYU 0 to 5,500 patients a day, that's an incredible number of patients. Yes. And to do that quickly means you have to make some trade-offs. And the whole organization has to be behind that to say, all of our outpatient business has been shut down. And what we want to do is to be able to care for those patients. So how do we do it? And we have to suspend some of our assumptions around what has to happen. And I think that's another really important barrier to overcome. You have to have everybody on the same page. You have to understand what the shared goals are, the sort of change management to get there, but the workflow, certainly from a reimbursement perspective, from a regulatory perspective, everybody has to understand at least enough to be able to safely practice. And for those organizations that were pretty quick to pivot and be able to implement a telehealth strategy and really digital health strategy, those are the ones who are able to capitalize on it. They kept their patients. They benefited from the regulatory changes from CMS saying, hey, we're going to not only relax sort of state-based licensure, but CMS is going to reimburse for telemedicine visits. And a huge number of private payers obviously followed suit pretty quickly. And I think at the end of the day, all of those things contribute to provider organization adoption.
Yeah, I agree. I agree with everything you just said. And I think one thing I want to highlight, just from my perspective being out there, is the workflow and also the flow of data. And I want to challenge the industry. I always do this. I come from the vendor perspective, but I've worked on the provider perspective as well, from a provider perspective. But interoperability is key. The Cures Act also helps enable that more. But I also want to challenge vendors. I've been out there even recently managing these telehealth and virtual care platforms. And there's some vendors who think transferring a PDF is acceptable. And I was doing that in 2011. It's not acceptable today. And please, if you're a care provider listening to this and someone's trying to pitch to you that a PDF is perfectly fine, that's considered interoperability or that's interoperable data, it is not. And there are better systems out there, and you deserve better, and your patients deserve better. So what do you think of that?
I agree. I mean, at the end of the day, a PDF, even talking about like being able to move medical records from one platform to another, that's not really for the most part, that's not really actionable information.
Right. It's not.
And so what we want to know is, why did the patient come in today? What are the problems that they're having? What access do we have to their prior history? Mm-hmm. And how do we use their prior history to inform the visit today? And I think you had asked about like the technology. We want it to be lightweight. Yeah. We want it to be really provider friendly and patient friendly. And if we can help them navigate the care teams and the patients, help them navigate the technology, do a lot of it so it's self-serve and it doesn't require a tremendous amount of management or oversight. I mean, I think all of those things are really valuable. And with those things, that's where we can get more adoption, better utilization of these products and services. And I think that's where, again, I go back to the, Livongo and Teladoc. That's not the only version of this, but just starting to see more and more collaboration around, Livongo looks, feels, and operates like a direct-to-consumer company, even though they work primarily with employers. But their culture and what they've gotten really good at is building an experience for the user, for the patient, that is so much better than what was previously available, that they've obviously built a significant company and got acquired, relatively quickly.
Yeah, I'm not as bullish though as you might be on that one, but that's going to be another good show. But I agree on the Livongo side, but some of the go-to-market stuff I'm not as bullish on. However, I do want to give you a couple of seconds here just to talk about some of your thought leadership. As we close the show, we got to close it here in a minute or so, but I would love for you to, where can people find out more information about you? And then also we'll certainly promote some of your shows coming up.
Yeah, that sounds great. Certainly, you can go to my website, sylvanwallermd.com. You can learn a little bit more about me there. I work with, as I said before, a number of early stage digital health companies. I work with a lot of physicians as well who are looking to get into this space. And then I work with investors, not to really supplement from the physician perspective and the patient perspective. How are things going to be adopted, and how do we expect to see, the market increase, and how do we expect to see, penetration in a given market increase? And I think, digital health is a great example of that. If you've got experience on the ground and you've seen what works and what doesn't, that can be very valuable to all three of those different pieces of the market, if you will: providers, investors, and obviously, the digital health companies that are very focused on patients.
Yeah, excellent. I'm excited for the future, my friend. Thank you so much for joining me today. I appreciate you taking the time out of your busy schedule to join us. And everybody, thank you so much for the time that you've given us. Look forward to some of my shows coming up, certainly Sylvan shows coming up. We'll keep you posted as that all evolves. And as always, you can track me on Twitter at HIT Advisor and use the hashtag ThisJustinRadio so we can respond to your comments from the show. If you miss any of this episode or want to hear more, all my shows are posted on Apple iTunes, SoundCloud, iHeartRadio, Spreaker, Google Play, and TuneIn. Also, you can check out some of the new content we posted at justinbarnes.com. Thanks, everyone. Have a terrific week and stay safe.